15 minutes, please. Thank you.
Thank you. Thank you. Good evening, everyone. And it must be a very long day for all of you. So I'll do briefly today industrial injuries to foot and ankle. So the incidence of foot and ankle as such, the injuries is 9.9, around 10% of all the bone injuries, and it is most commonly in between 25 to 30 years and more common in males. Ankle injury is more common in service jobs, whereas the foot and toe injury is more common in manufacturing. The ankle injury, most commonly, it is 70% is sprain and strain. Fracture just 15%, followed by contusions. In foot, most common is contusion because foot has the metatarsal, they are covered by muscle layer and soft tissue, so the contusions are more common. Fracture is just 20%. Toes, they are bare bones, so fractures are more common. Now, the most common mechanism of injury is by contact or object of heavy or fall from height, exposure to harmful force like vehicles and machinery. Impact, you know better than me, the loss of working hours, a lot of medical expenses and financial compensations. Now, the site of injury anatomical, if you see, the ankle consists of 32% of injuries, followed by metatarsal, toes, heel and soles. Now, predisposing factor of industrial foot and ankle injuries, it is increased in young and inexperienced workers. In literature, it shows that 55% workers, they are less than 30 years, those who get more ankle and foot injuries, and 65% those who are less than 5 years experienced. Now, other also predisposing factors which are in the literature, most common these injuries are on Monday. I don't know what is the logic. And it decreases with the rest of the week. Is more before lunch, increase late in afternoon, and least common on Friday. These are American data. Indian data, you must be more knowing more. Now we'll go by one as the anatomical area. Now the phalangeal injuries, the mechanism is direct blow. That's worker comes to you, the nail bed, bleeding, contusion, and mostly they are contusion or small fractures. The only severity is when there is a soft tissue loss. Otherwise, these are managed well with conservatively. Now, forefoot fractures, the most common forefoot fracture, 50% is the first metatarsal and 25% is the fifth. Now, the first is, it makes medial arch. So, the first metatarsal, great toe is more important, and the fifth one, in between, they are not important. So, if the fracture in the foot, first or fifth, we have to treat them aggressively. In between, they are supported by first and fifth, so not so important. Now, if they are undisplaced, they are, as you know, they are in a general fracture principle, plaster cast, non-weight bearing, and displaced fracture, we have to treat them internal fixation. Coming to metatarsal injury, that they are caused by direct when foot is trapped under a heavy object, or indirect by plantar flexion and inversion injury, most commonly on the step injuries. In metatarsal area, again, the common is contusion, that is a soft tissue injury, majority of the time, and they get traumatic synovitis, extension tendon synovitis, fracture of the metatarsal bone, sometimes fracture and dislocation called Lisfranc fracture, and compartment syndrome. We'll go one by one in brief. Soft tissue injury, contusion, that it is due to fall of heavy object, and the worker or the patient didn't have any fracture. So they require protected immobilization, ice application, non-weight bearing for 3 to 4 weeks. And metatarsal fracture, if they are displaced, then we have to fix them. If they are undisplaced, we have to put them in non-weight bearing cast at least for 4 weeks. Sometimes this injury, metatarsal fracture with dislocation, this is more severe, and most of the time it is missed also by orthopedic surgeon. And this fracture dislocation between first and second metatarsal, if it is missed, it is very difficult to treat later on. It is very disabling. Patient, those who are not treated, there's a lifelong disability. So Lisfranc fracture, that is fracture with dislocation, has to be treated aggressively. Sometimes there is due to the fall of heavy object, there is a bleeding in the foot, and the foot compartment get tense. So there is no fracture but massive soft tissue injury. which causes further decrease in circulation and hypoxia to the foot muscle. In such situation, the emergency release or fasciotomy is important, and once the swelling gets reduced, these fasciotomy we can close it back. These really saves the foot, otherwise the foot get all the atrophy of the muscles. Now the crush injury, where there is a fracture as well as the soft tissue loss, this require a team efforts, that orthopedics and the plastics. For example, the crush injury due to ankle, massive contamination in industry, and these initially require a good wash. We have we use pulse lavage, jet lavage to wash them. We use wash by first the saline, then betadine, then hydroxy, H2O2, hydrogen peroxide, then antibiotic, and we put them external fixator, and later on plastic reconstruction. Now in all the crush injuries, the vacuum assisted dressing, the VAC, has done wonders. For example, this foot, there is a loss of massive tissue. In olden days, it's very difficult to save such injuries, but now the vacuum assisted dressing, and with this, in that we put a this is the after vacuum assisted dressing. There's a good healing tissue and the flap is done. Another example of vacuum assisted dressing I'll show you. Now the injury to the heel is mostly the fracture of the calcaneum, which sometimes with displace has to be fixed, and if there is a massive soft tissue loss, these are very disabling. Now in vacuum assisted dressing, its logic is simple. We covered it with a sponge and then we make it airtight. We wrap it with a adhesive plastic, and then we make a small hole and put a continuous suction. What happened, the continuous suction, it gives always create negative pressure there, and it because of hyperemia, it create artificial hyperperfusion kind of things. So the blood circulation is more to the tissue, healing is better, the antibiotic penetration is better, it takes away all the microorganism and the debris. So VAC is, as my plastic fellow or the colleague says, the incidence of free flap has decreased in last 5 years. VAC has done wonders. So after this, see the VAC, they put a skin grafting and over that VAC, and its foot is saved. Now the ankle, which is the most common trauma in the industrial, it's caused by blunt trauma or inversion injury. As I told you, most common is the soft tissue injury, the ankle sprain and the strain, and these are the one which are the most neglected one, because the tendency is we do the x-ray and we say, oh, there's no fracture, so you go home. But these ligament tear has to be treated aggressively, because they give lot of the people, they keeps on, they have the ligament doesn't, they have to be treated like fracture only, because otherwise the ununited ligament or lax ligament or partially healed, if it keeps on giving recurrent pain, absence from the work, so they have to be treated like fracture only. So proper plaster cast or protection and immobilization at least for 4 weeks. And sometimes we wish them, because after seeing X-ray there is no fracture, we don't do MRI to see what kind of or what are the ligaments they are injured. Now fracture, which is because it is commonly diagnosed by X-ray and they are more aggressively treated. They can be lateral, malleolar, bimalleolar dislocation. For example, this is the ankle fracture, bimalleolar, medial, and lateral, both malleolar fracture. Now the spatial, very tricky is that this ankle anatomy or morta is the dome shape, fibular length, and the medial malleolar, they has to be fixed properly anatomical. If there is 2-3 millimeter step or malalignment, these injury, they give permanent lifelong disability. They always have pain, later on develop ankle arthritis. So they have to be fixed properly. This is another example of ankle injury, very bad fracture. Now we have better plates, anatomic plates, so we can reposition fracture in anatomic position and results are good. For example, there is a multiple fragment called pilon fracture with all the shattered lower tibia and ankle, which has to be fixed from all around. Now compound fracture with wound is it requires more care, more energy, and for example, this is a worker, some steel coil fell down. Now in such situation you should put some anti betadine or pyridine solution and wrap them in a sterile sheet and then transport to the hospital. And we have to operate them as early as possible, otherwise the contamination happens and very difficult to save such limb. Now this is, we do pulse jet lavage, cleaning with antibiotic solution, scrubbing, and then we put them back with minimal hardware because they tended to get infection. And this is after 8 weeks. So if it is managed in proper time and as early as possible, results are good.
It's 5 minutes.
Yeah. So sometimes these are the bad fracture and industrial worker, and they are seropositive and their CD4 count is less, so we can't put many of the implant. Then we have to make some strategy for minimal internal fixation fixator, and later on plaster cast as early as possible. Ideally this should have been operated, but CD4 count just 50. We can't put implant because chances of infection are high. Now injuries, certain injuries, they are by occupation. If I get a history, okay, some painter fell down from 10 feet, I know he must have some calcaneal fracture and also compression of the spine. Welders, they get burned from metal fragments and treatment debridement. Industrial cleaning, as they get more scalding water burns. Pipeline worker, more common local wound, there's frostbite, and they require just local wound care. Electrical worker, they get high voltage burn. The main issue is, as your theme is prevention, so I think you guys do it better than us, is education, training of your employee, strict safety norms, good quality shoes, which is very important. As per the American National Safety Institute, they mandate industrial shoe wear specific for the job. Like for the construction worker, it has to be, there should be proper safety for the toe, and it has to be puncture resistant, electrical, it has to be non-conductive sole. So industrial shoe wear, if worker adhere to wear it and a good quality, many injuries can be prevented. I thank you very much for your patience.